Imagine a patient sitting up in bed, looking perfectly fine. But in just a few minutes, their condition plummets, and they're fighting for their life. What made the difference? It could be just 5 numbers. I'm a nurse, and today I'm going to show you why these 5 numbers, the vital signs, are so incredibly important. I'll break down what they reveal about your body and how they guide the life-saving care we provide every single day. Make sure you stay until the end, because knowing these numbers could literally save a life, maybe even your own. Vital signs are the body's early warning system. Think of them as the dashboard lights of a car. They tell us how well the essential systems, the heart, lungs, and circulation, are working. Even a seemingly small change can be the first clue that something is wrong, like an infection brewing, the early stages of shock, or developing respiratory distress. In the hospital, this is why nurses are constantly checking vital signs. We're not just bothering you. We're looking for those subtle changes because we know that catching a problem early is the key to preventing a catastrophe. Early detection truly saves lives. Let's start with the first vital sign, body temperature. For most adults, a normal temperature is around 36.5 to 37.5 degrees Celsius, or about 97.7 to 99.5 degrees Fahrenheit. If that number starts to climb, we call it a fever, which is your body's classic signal that it is fighting off an infection or dealing with inflammation. On the flip side, if the temperature drops too low, it could mean hypothermia from cold exposure, or it could be a sign of a more serious condition like shock. A change of even 1 or 2 degrees might not seem like much, but for a nurse, it's a major alert that something serious could be happening and needs immediate investigation. Next up is your pulse, also known as your heart rate. This tells us how many times your heart beats per minute. For a resting adult, a normal heart rate is typically between 60 and 100 beats per minute. If it's too fast, a condition called tachycardia, it could be caused by things like pain, fever, anxiety, or even hidden blood loss. If it's too slow, known as bradycardia, it might point to an underlying heart condition or be a side effect of certain medications. The pulse doesn't just tell us the speed. It gives us a real-time report on how efficiently your heart is pumping oxygen-rich blood to the rest of your body, which is essential for survival. Now let's talk about breathing. The respiratory rate is the number of breaths you take each minute. A healthy resting adult typically breathes about 12 to 20 times per minute. If someone is breathing much faster than that, it can be a sign of respiratory distress, a lung infection like pneumonia, or low oxygen levels. If they're breathing too slowly, it might be due to the effects of strong pain medication or a sign of impending respiratory failure. What is so critical about the respiratory rate is that it is often one of the very first vital signs to change when a patient is getting sick, sometimes even before they feel unwell. This makes it an incredibly valuable early warning signal for nurses. Another crucial number is blood pressure. This measurement tells us the force of blood pushing against the walls of your arteries as your heart beats. It's given as 2 numbers, with a normal reading being around 120/80. If the blood pressure is too low, it could indicate serious issues like dehydration, internal bleeding, or shock, meaning the body's organs aren't getting enough blood. If it's too high, it puts extra strain on the heart and blood vessels, increasing the risk of a heart attack or stroke. Blood pressure readings help nurses make critical, on-the-spot decisions, like whether to give more fluids, adjust medications, or start treatments to support the heart. And finally, we have oxygen saturation, often called SPO. This is a measure of how much oxygen is being carried in your blood. You'll see this measured with a little clip on the finger. A normal healthy reading is between 95 and 100%. If that number drops below 90%, it's a condition called hypoxia, which means the body's tissues aren't getting enough oxygen. This is a medical emergency that requires urgent intervention. What's particularly dangerous about low oxygen is that it can be a silent problem. A patient might not even feel short of breath, but their oxygen levels could be dangerously low. This makes monitoring oxygen saturation absolutely vital, especially for patients with lung or heart conditions. So, how do nurses put all this information together? Vital signs are never just a set of random numbers we write down on a chart. They are the language the body uses to tell us what's happening on the inside, and they guide almost every clinical decision we make. We use them to see if a medication is working or causing a side effect. We use them to decide if a patient needs oxygen therapy. We monitor them closely after surgery to watch for complications. We use them to catch infections before they become life-threatening. Every single reading is a piece of a puzzle that helps us build a complete picture of a patient's health and, most importantly, keeps them safe. Let me give you a couple of real-world examples. Imagine a post-op patient who looks comfortable and says they feel fine. But when I check their vitals, I see their oxygen saturation has dropped to 88%. I can immediately apply oxygen and alert the doctor. We just prevented a potential respiratory collapse. Or consider another patient who develops a slight fever and a fast heart rate. Those two changes together are a huge red flag for an early infection. By catching it then, we can start antibiotics right away, stopping a minor infection from turning into deadly sepsis. In so many cases, these numbers speak much louder and earlier than a patient's symptoms. Ultimately, vital signs are the first line of defense in healthcare. For nurses, knowing how to accurately measure them, correctly interpret what they mean, and act on those findings is one of our most fundamental and critical skills. It's a constant cycle of assess, intervene, and reassess. These 5 numbers, temperature, pulse, respirations, blood pressure, and oxygen saturation, have an endless impact. They prevent complications, guide recovery, and, without a doubt, save lives every single day. So, whether you're a nursing student trying to master these skills, a patient who wants to be more involved in your own care, or a caregiver looking after a loved one, understanding vital signs is empowering. If you found this helpful, please share this video. The more people who understand this, the safer our patients will be. And don't forget to subscribe for more practical nursing education and real-life healthcare tips. Thanks for watching.